Welcome to Pearls for Parkinson's. Here is this week's daily living tip. Welcome back. Today we're continuing our discussion on low blood pressure and Parkinson's. We've talked about how to monitor blood pressure and discussed natural ways to try to treat it, as well as some of the devices and garments that can be used to help increase blood pressure naturally. However, sometimes people just can't get that blood pressure up, even with those natural remedies. And so there are times that people have to trial medications to try to increase the blood pressure. So today I thought we'd cover what those medications are so that you're familiar with them should it be brought up at a visit with your provider. There are many different reasons why you might need a medication to help bring it up. First of all, you could be on a heart medication that can actually be used not for blood pressure, but for a heart rhythm problem. And so people who are on medication for a problem called atrial fibrillation and some of the other heart rhythm problems can be on medications that also tend to lower blood pressure. And so you don't want the lower blood pressure, but you do want the heart rhythm control. And so sometimes it's a matter of instituting other medications to help support the blood pressure. So 3 medications are used to help treat low blood pressure. The first one is called midodrine, and midodrine is a medication that works by constricting the blood vessels in the periphery. And what's the periphery? That's your arms and your legs. So by constricting those blood vessels, more of that blood supply and that blood pressure increases to the core and the brain and helps to sustain the blood pressure. So that medication is normally given 1, 2, or 3 times per day. Most of the time, we try to keep it in the morning and the afternoon and try to avoid bedtime because it can cause high blood pressure while you're sleeping. And but that's also to the discretion of your provider, but something that you would want to monitor. The second medication is called Florinef or fludrocortisone. And that medication is a corticosteroid. And so people who are having problems with high blood glucose or are diabetic might need to really watch those numbers if you're put on fludrocortisone. That medication is a medication that works by increasing your kidneys' production of sodium. And so it then is reabsorbed more as sodium. So it helps you to retain fluid. So people who have congestive heart failure or have a lot of problems with like lymphedema wouldn't be able to use fludrocortisone, but most of us would tolerate it quite well. And you would just want to monitor any like problems with swelling in the legs. And those people who are on fluid restrictions or have kidney problems would definitely want to consult their doctor on the use for that medication as well. The third medication is called Northera, and Northera was specifically studied for low blood pressure in Parkinson's disease. Actually, it's an indication called NOH, or neurogenic orthostatic hypotension. And so this is neurogenic. So this medication works on some of the neurotransmitters. The main one is norepinephrine, and it increases norepinephrine. And so that helps to increase your blood pressure as well. So that medication is given twice a day. And again, that's called Northera. Another name for it is droxidopa. I hope you find these tips useful and you go in with more knowledge to your appointments, and you tune in next week for more Pearls for Parkinson's. The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.